Hi, this is Debbie from the Cherubs Breastfeeding Support Service in Cheshire. I'm doing a quick video today about nipple shields. It's something that seems to have a bit of controversy attached to them, and it certainly should be something that you're using with knowledge, but they're not the devil either. So I have a few examples to show to you today. I'll talk through how to use them and apply them, and obviously the benefits versus potential downsides of using a shield, and also how to care for them. So to start off with, I'm not making any recommendations in regards to brand. The important thing is you should be with somebody who can help you establish which size and style and shape is going to suit you the best. And often what people think is that the shield should mimic their own nipple shape. But actually, it's not just the nipple that they're covering. There is going to be space at the end of the shield where your breast tissue gets pulled into when it's in the baby's mouth. So that space is really important. So I have here, this is a Tommee Tippee shield. I think we can see that okay. Almost feels like one of those makeup videos that they show to the camera. Okay, and as you can see, there is like an elliptical shape to it. So if I turn it that way, it's now longer, and if I turn it that way, it's now shorter. And with the two shorter edges, this part here is slightly shorter than this part here. So it's actually designed that the baby's nose is going to be opposite this part here. The chin would be here, and these parts are where the cheeks would be. So if I was feeding my baby, and for the time being I'm just going to place this on the breast, I would pop it on that way onto the breast, so that when the baby comes across my body, the nose is going to end up here where the shortest part is. Chin over here, cheeks over here. Okay. I also have a Nipple Shield, so you can see, oh, it's a bit difficult to see here, but you can see that we have a rounded part down here, and then a little bit difficult to see, but we have like a wavy cutout part here. And that is again where the nose goes. So for here we have a wide part for the chin, wider part for the cheeks, and the nose would be here. So again, if I was bringing the baby across my body in a cross cradle position, then I would place the shield on like that and bring the baby across to the shield. So there was no silicone in the way of baby's nose flapping around and annoying poor baby. And the other one I have to show you is, this is a Mum shield. So this has two cutout parts and wider parts, and you've got nose and chin section there. Not too fond of this one. I don't know if you can tell there, but it's wider one side and then flatter the other. And it's actually quite a rigid, stiff one, and quite narrow the base. So you would have to have a particular small nipple to be able for the nipple to go in and pull some areola tissue in there. But somebody out there somewhere may have that nipple, that anatomy. So yeah, again, you would put it on, bring your baby across the body, it would go on that way. So baby comes across. If you were feeding, regardless of shields, if you were feeding your baby in an underarm position and baby was coming round and under, then your shield would go on that way, because that's where the baby's nose is going to come to. And with the Nipple Shield, same again, you'd have the cutout part at the top this time, and the Tommee Tippee shield, the narrowest part at the top, and baby would come round and over the shield this way. Okie doke. So you've seen me placing shields on just to show you angles and the way they go around, but that's not actually the best way to put them on. But as you see, mums doing that all the time. If we just rest it on, then it's a little bit loose. It's prone to getting knocked off by those little hands that come up when you're desperately trying to get your baby on. And also, because we do want quite a good space at the base of this shield, room for your breast tissue to go into, you could potentially put it on slightly off centre. So with this one here, if you can see, I've slightly off centre, and when your baby goes in the mouth, when this goes in your baby's mouth and your baby starts to pull, you're going to be pulled off centre, so the milk transfer won't probably be great, and that probably is going to smart a bit, that is. So what we do instead is, if I've got the sticky out bit facing you now, you're going to press on the knobbly end and partially turn it inside out. So we've got a knobbly bit still there, that's how it looks there, and then you can just place your finger on that, keeping that partial inside outness there, sorry, not the best of language there, and then you can place it at whatever angle you're using. You can centre it right over the nipple and then place it down, and what usually happens then is it pops back into the correct place and brings a little bit of nipple tissue with it. Not so great with this big silicone boob because there's not a great deal of stretch for it, but again the same with the Medela Shield, so we can actually get that one to stay in that position, and then we can place the knobbly bit centered over the nipple end, and as you press down, because this one stays in place, it does need a little bit of teasing, so as you're pushing it out, it pops. If it needs a bit of help, you can just give it a tease and that should pop out for you. So when you're putting a baby on the breast with a nipple shield, we still want the shield to be going up towards the palate. So if we're putting it on now, on the breast, you want your baby's head still to be coming towards you with their head tilted back, so that this part here is going up towards the palate. So we don't really want babies going straight on like that. We still want babies brought back a little bit so it's pointing towards their palate, up their nose, and then we can get their bottom lip to hook further down here and a big mouth over the top. And then once your baby's on it, we shouldn't see the baby's lips just on the shield like this. It should be a big wide mouth taking all of that shield in. So if you see your baby's lips just slurping up and down on the shaft of the shield, I'm not sure if we'll be able to demonstrate it on this breast, or if your baby appears to be on it but you can see it sort of imploding and disappearing into the breast, then that's not right. You need to take your baby off and get them wider mouth right over the top and take the whole part in. So the only bits you should be aware of are these little bits here that might flap around a little bit at the edges, but you shouldn't see little sucky lips on the shaft itself, much bigger mouth. Oh yeah, and another tip as well, when you're bringing your baby on, although we've put it on partially inside out and we've got as much suction as we can and gripping to the breast, it's not true suction because obviously there's holes in the end. So that does mean that if you're still practicing and bringing your baby to the breast and you're still fighting a little bit with the arms, hopefully you've got one tucked under the breast, the other arm's up here somewhere, but occasionally arms can sneak in, or the head goes back and forth and it could knock the shield off, and off you go, you're starting again from scratch. So you can help yourself a little bit by just using your thumb and your forefinger to just hold those wide edges, so where the cheeks would land, you're just going to press against the breast. You're not going to pinch it, you don't want to break the suction, you're just securing it so that if anything comes up and tries to knock it, it's not going to knock it off. So then you can bring your baby across, this pointing up towards the palate and mouth coming over the top, and then once baby's on you should be able to let go and that's not a problem anymore. Once baby's sucking and got suction going, the shield should be perfectly safe and not going anywhere. Okie doke. So when your baby's feeding with a shield, you might find that milk transfer is not quite as effective for some babies, but for other babies they're using the shields because they can't get on without it, and of course if they're not getting on without it then milk transfer is very poor. So it's very much a balance of what's an advantage of using a shield versus what the cons are. If you find that your baby is able to latch without a shield, but you're using it for pain relief whilst you're getting the source of the pain sorted, you might find your baby needs to take longer to feed. So you could do breast compressions to help counteract that. So if your baby's on and baby was feeding very well, seemed to be drinking and gulping quite a lot, but then starts to slow down, then you can do breast compressions. And I do have another video on this. So the main video under our Cherubs channel, which covers the basics of good positioning and attachment, and breast compressions as well. But basically, when baby sucks, you squeeze and you hold, and you just hold it there. It's a firm pressure but not painful. And then when your baby relaxes, takes a pause, you pause with baby. So a little bit more milk dribbles down, and then baby starts to suck again and you'll squeeze and hold. So if there is a little bit of a difficulty, or baby's not as efficient as they were without the shield, and you feel they need a bit of help, then you can do your breast compressions. And you can do it as a C shape, or you can go underneath as a U shape, or sometimes mums will come over the top and do it this way. So there's no right or wrong, it's just whatever works for you. There is some suggestion that shield use may increase the chance of blood ducts, which can then tend to mastitis. So again, being very breast aware whilst you're feeding, compressions, a bit of massage of any areas that still feel quite full and soft, full and plentiful milk in there, then you are helping drain that breast more effectively. So you're getting it in baby, baby's getting plenty of milk, and you're draining your breast as well as you can. Reasons why you might be using a shield is, as I mentioned before, it could be pain related. So if it's the difference between you having a feed that's much more comfortable and bearable, and you're able to do the next feed and the next feed and the next feed, then you may decide that using a shield is advantageous. If the option without using the shield would be that you just felt like you were going to crash and burn and you couldn't feed because it was too painful, then breastfeeding is going to come to an end much earlier than what you would potentially like. So in that instance, you may decide that the use of a nipple shield gets you through the feeds. But the most important thing is you really do need to get some specialised support in quickly to help identify the cause of the pain. So if you use a shield very, very quickly on and you're not quite sure why you're using it, why there was pain in the first place, that's not being investigated, then the chances are that whatever's causing the pain is not being identified. So it's not going to rectify it, it's just going to mask the symptoms for a bit. But potentially, without identifying it, problems can continue to occur until you kind of go down the line and you know, you may well have lost some of your supply, or baby's weight isn't great, and then there's supplementation and you just kind of go, oh, this isn't working and I'm not sure why, but it's not for me. So I suppose the key point is, whatever reason you're using a shield, it really does need to be in conjunction with getting some good skill support to help you identify the issues. So we've talked about pain. It might be maternal pain that is the motivation to use a shield. The other motivation could be that baby struggles to maintain attachment or gain attachment at all to the breast. And there could be various reasons for that. The most common reason, when we put positioning and attachment aside, that's the most common reason. So if we've had a look at the technique and it's optimised and it should work but it's not, then we would look at other things. So the most common reasons beyond basic position and attachment issues would be tongue tie. So if baby's tongue is not able to move as freely as it would like to, and because there is a tether underneath the tongue, which is particularly thick or short or tight, sometimes they can be seen anterior, sometimes they're hidden at the back and can be quite sneaky to see. That can impact on baby's ability to attach and maintain attachment. Other reasons can be sometimes babies can have slightly wonky jaw, which often is down to placement in utero in the last sort of few weeks or month or so. And it's very, very common. It's usually something that rectifies over a few weeks or a couple of months. And if you think that, you know, your upper and your lower jaw should be parallel, but if one is slightly off, that can cause attachment problems. So a shield can act as an attachment aid for a tongue-tied baby or a baby that seems to have attachment issues but we've ruled out tongue-tie, and it could be something like jaw asymmetry. So also for babies that are maybe very small or are not weak, but you know, maybe had some low blood sugars or a bit small for age, maybe a little bit of prematurity. Those babies sometimes need a little bit of help from a shield. It can benefit them. When a shield goes into the baby's mouth, it's quite a firm teat, a bit like a bottle teat. And it can go up into the baby's mouth and trigger the baby's suck reflex. So we sometimes check if a baby's hungry by popping a finger in their mouth and seeing if they suck your finger, but they will do that anyway because it's a reflex. And this can trigger the reflex. So when they start sucking, the nipple tissue then gets drawn into the right place and milk will start to flow if it's a good attachment. So without this, it's the baby's ability to be able to cup the breast, wrap their tongue around it, maintain their tongue in an outward position and be able to then elevate it and form a seal and suction to draw the nipple into this kind of shape deep into their mouth. And then they need to keep that up as well. So if they're not quite getting it to the right place in order to trigger the suck reflex, then they can sometimes do a few suckles and then just stop and not do anything. And unfortunately, those babies sometimes are labelled as lazy feeders or lazy babies, and there is no such thing as a lazy baby. Babies they're hardwired to breastfeed, and they will feed effectively if given the proper opportunity to do so. So if there is some attachment issues, then Shield can definitely act as a latching aid. So the mum might not be using it for pain, she might not have any pain, it could be for the baby's benefit. So again, when you're weighing up the pros and cons, you want to kind of look at, okay, well, if I don't use a Shield, then I'm not sure how to attach baby on, but I do want to breastfeed and I want this investigated. And if I don't use a Shield, then my next option is to be expressing and either syringe, cup or bottle feed my express milk to the baby. And that's the complete valid option for a mum to consider. What she might want to think about is the implications of that. For many mums, they may feel that expressing and bottle feeding requires time attached to the pump, so you're looking at least 20 minutes, at least 8 times a day. So around about 3 hourly pumping to mimic full-term breastfeeding or full-time breastfeeding. And then there is the preparation, the sterilising, the washing, all of that, whereas actually popping one of those on and doing it direct at the source is a lot less faff for many mums. If she does use the Shield and that requires a latching aid, there is a small chance that baby will always require the Shield. It might be because that's what baby's got used to, or that whatever the issue is, it's not been very easy to resolve, but the Shield does enable the feeding. So over the 8 years or so that I've been in this role, I have come across a very small handful of mums where for them feeding, and they've fed for months and months and months, has always meant that a Shield was involved. But you know, months down the line, babies are bigger and better and help you out more. Mums are very adept to just getting it out, whack it on quick, and baby's on before they know it. So it does become easier and easier. And again, on balance, you might go, okay, well, without the Shield, I wouldn't have got to where I am now. So everyone's going to come up with slightly different sorry, I can't think of my words. You know, people will have different advantages and different pros and cons, basically, of what they feel is the right decision for them. But I suppose the key thing is whatever your reason for using one, please use it alongside some ongoing support so that it's seen as a temporary measure. But it's certainly, they can be so useful for some mums and babies whilst we get things going. So they've got their absolute use, and you know, many mums have come forward going, you know, if it wasn't for the Shields, I wouldn't be feeding at the start. So you know, they've loved the fact that they've had something to help them on their journey. Excuse me. So in terms of care of them, when you usually purchase them, they're somewhere between £5 and £10 for one pair usually, and you only need the one pair. You don't need to buy loads and loads of them. They should last you a good while, and they're just soft silicone, most of them, and you can just wash them in hot soapy water. Because milk is passing through as opposed to being stored in it, you don't have to sterilise them after every single use. If the steriliser is going on anyway, you can pop them in, but good soapy hot wash, and then just rinse off the excess soap suds, perhaps with a little bit of boiled kettle water, shake off the excess, and you usually come with little pots. So the Medela ones come with this, ow, sharp. They come with this little pot where both your shields will fit in, and I'm not sure, I think this was the Tommy Tippy one, possibly. So they all come with little pots, so it's easy to go out and about with them and keep them clean and fluff free, so not floating around the bottom of your nursing bag, your baby bag. In terms of sizes, I did touch on this before. This Medela one is a 20mm one, so this is the medium. They also do a 16mm one, and they do a 24mm one. I'm far more likely to come across mums requiring at least this size, and often the 24mm, because it's the base size that you want to make sure that not only does the nipple enter into it, that there is also room for the areola to come in. So what we shouldn't see, perhaps if I could demonstrate on this one, because I think this is the smallest one, if my thumb was the nipple, I don't want just my nipple to get caught in there and just catch on the edges. I actually need more breast tissue to be able to enter that. So I might have been better with a nipple size closer to my little finger there, with room at the sides for nipple tissue, breast tissue to go in as well. Sorry, not the most brilliant of examples, but the man one, I'm not entirely sure what size differences they come in. There is a Nook one that comes in a couple of different sizes, which is not too bad. The Tommy Tippy one is just one size. That was back to this one. I'll just say for Tommy Tippy ones, they aren't the longest of shields. So if I just stand it up alongside, it's just slightly flatter than this one, and the 24mm of this one is even slightly bigger. And so if it is something that needs to go into baby's mouth quite deeply and trigger the suck reflex, you might find that that's still not quite enough. If it's not that baby has any difficulty with attachment, it's more about pain, mum might find that one comfortable. So it is very much about trying different ones, really. So I was talking about sizes, wasn't I? Yeah, the other brands that I've not got with me today that's quite readily available in the shops is the Avent one. The Avent one, as far as I'm aware, just comes in one size. But it is quite a large one, so it is quite similar to the 24mm Medela one, and it's also quite a stiff, quite a rigid nipple section to it, so it could well help some babies with attachment problems because it's quite firm and long and wide, and it really goes in there. Or if mum's got particularly a lot of damage and she needs extra support between baby's mouth, palate and tongue, and any chafing going on. And the shape of the Avent one is probably most similar to, so not seeing very well here, to this one. So it has a cutout section for the nose and the chin and wider cheek portions. Okie doke. So I think I've gone through quite a bit of detail there on nipple shields. So as I say, they can be really, really useful for some mums and babies to get them going and to basically get breastfeeding to work whilst any issues are being identified and resolved. But you also need to be aware about what might not be so great, so it's important that you get the right size for you and for the baby, so that it's a really good fit and the baby's not just catching the end and it's triggering the suck reflex, and that a lot of breast tissue's going in and there's good milk transfer. And They're relatively inexpensive and easy to care for. So say hot soapy wash between use and pop them back in their case. So that's it. Thank you very much for listening, and I hope you find that helpful.